The views and opinions expressed in the following program are those of the speakers and don't necessarily represent the views or opinions of this station, its staff, or management.
Welcome to Saturday Morning with Dr. Sara Little. Dr. Little is a board-certified pediatrician at Middletown Community Health Center's Port Jervis Center for Pediatrics. Every Saturday morning at 7 a.m. on WYNY, Dr. Little and her guests will focus on children and families, parenting, family relationships, and healthy lifestyles. Today, Dr. Little's guest is Dr. Manny Martakis, board-certified pediatrician at the Port Jervis Center for Pediatrics and columnist for the Times-Herald Record. And now, Dr. Sara Little.
Good morning and welcome to your Weekend Healthy Chat. I'm your host, Dr. Sara. I'm very pleased to announce that our first guest today, he's a board-certified pediatrician. He's also practicing in Port Jervis, my colleague, friend, and partner, Dr. Manny Martakis. Welcome.
Good morning. Thank you so much for having me on the show today.
Today we will be discussing a very prevalent issue seen frequently in our community, as well as a definite question on many parents' minds, childhood obesity. So, Dr. Martakis, how do you define obesity?
Well, according to the doctors, and that is, among which we are, childhood obesity is basically the excess percentage of body weight due to fat that puts people at risk for many health problems. We doctors, we assess that with a measure that's called the body mass index.
So for our listeners, what exactly is body mass index?
Pretty much the body mass index is a calculation based off the child's weight and height. What we do is we actually take the height and we measure it in meters squared, and that's divided by the weight, which is in kilograms. And then using that, we determine whether or not the child is overweight, obese, or morbidly obese. Now, we have a set of parameters that we go by to measure how much weight a child should have for their age. And we measure this by percentiles. So if a child is at a percentile that's at 85th, take it, say, from 0 to 100, and at an 85th to 95th percentile, that is considered overweight. And that is usually measured as by the integer of time. If the child is above 95th percentile, then that goes into the realm of sheer obesity.
So what are the current trends that we've been seeing lately come through our office?
Well, unfortunately, we've been seeing obesity becoming more and more prevalent, especially among younger and younger children. Initially, obesity was more of a problem for the teenagers, but now even the preteens are having a big problem with, are showing up more and more with obesity. There's a lot of reasons that we see for this, one of which, of course, is the kind of food that children take. Children are eating, unfortunately, less and less healthy foods. I think that's also based a lot on the availability of certain foods. For example, a lot more junk food, sugar-rich foods, sugar-rich sodas, and soft drinks. Some of these sodas have as much as 17 packs of sugar per cup, and unfortunately, when people are taking even larger and larger drinks and larger cups of these drinks, they're incorporating more and more sugar, which will unfortunately lead to more and more fat because of the calorie intake. Another thing, too, also is that children are becoming less and less active. A lot of children are, they're spending more time inside, either watching television or playing video games, where they're sitting down and not doing any real physical activity. And this also leads to a problem because it comes back to caloric intake. And if a child is not exercising or running about, they're not using up the calories that their body is taking. So the body's natural instinct is to store all those calories that the body is taking in, and that's stored in the version of fat.
Well, very well said. Very well said. So what are some of the negative health outcomes that we see associated with obesity?
Well, a lot of the health outcomes include asthma, obstructive sleep apnea. Children can get skin infections from a lot of the from their from the rolls of fat that they may have. They can get complaints of joint pain, especially since it's more weight for a child's young frame to carry, and a lot of their bones are still immature. High blood pressure is also a big problem. And another thing that is very, very worrisome, but it's very hard to detect, is also diabetes. Now, usually diabetes is separated into two kinds, type 1 and type 2. The type 1 is essentially a failure of the pancreas to produce insulin, but the kind that's associated with obesity is called type 2.
Have you seen a rise in type 2 diabetes in the office lately?
Yes, we have. And there has been, it's a very worrisome trend, unfortunately. It's usually found either through checking a child's blood for sugar, or also we check the child's urine for sugar and for a substance that we call ketones. And I'm finding a lot higher number of children that are becoming positive for this kind of test. Signs that you would see for diabetes, sometimes just urinating a lot. We call it frequency, but really what it is the child's running more and more to the bathroom very, very frequently. And that sometimes can lead to, and that is one of the that's one of the underlying symptoms that you can see for diabetes.
So what are some of the emotional and social concerns or the stigmata that goes along with obesity? Well,
unfortunately, for children who are obese, a lot of problems include lower self-esteem and lower self-confidence. Their peers may pick on them. They may be subject to bullying. This can lead to poor academic performance. They have fewer friends. And unfortunately, there's a lot of you get a lot of problems of truancy for children who are more obese because of these problems. And this also leads to other problems later on. It can lead to problems like depression. Other disorders such as bipolar disorder can also come up as a result of this. Unfortunately, it turns into a very vicious spiral where their obesity leads to these emotional problems. It affects their schoolwork, and then from the schoolwork and their association with their peers, they start to go more and more into a vicious cycle where they become feeding into their own depression, into their own sadness. And a lot of these children require help to help pull them out of this vicious cycle, and that is either through counseling or through psychiatric help.
So kind of using food as a crutch to help them get through their emotional difficulties.
A lot of them do, and it's amazing how I would find that a lot of children will actually start to increase the amount of food that they take. So they will tell me that these children take like 3 meals a day, but what they don't tell me is that they have maybe 4 or 5 servings of food in one sitting. Or, for example, for them, a serving that doesn't necessarily include just like, say, 6 ounces of meat, but may include 3 or 4 12-ounce steaks, which that in and of itself is a massive amount of caloric intake. You've also got other things to consider too. How much do they take in for snacks? Because my idea of a snack may not necessarily coincide. So say a small bag of chips for you or me may mean for them, like as for a simple snack, an actual 20-ounce or even a 40-ounce bag of potato chips that they can finish off in 5 to 10 minutes. So there's also an education aspect that needs to be applied too, to tell them how much, to educate them on how much food is technically how much food is enough and how much is too much for them to take. The other issue too is also the nutritional aspect of some of these foods. I mean, there are some snack foods that are good for you, and there are some snack foods that just go under the qualification of junk food. And unfortunately, even just by driving along the street, seeing people walking by with giant plastic tubs full of cheese doodles or a whole 20-can box of soda going into their homes for a weekend, it kind of makes me cringe to think of that they're going to finish that all off maybe in 1 or 2 days or maybe even less.
Yeah, it's very scary. So what are some of the suggestions or the helpful hints that you give to parents and families who are struggling with obesity?
Well, the first thing involves just education. There are some basic guidelines that we go by with regard to educating people about not just diet, but also for activity. First, let's start with diet. The most important thing for children really is eating at least 5 servings of fruit and or vegetables per day.
So what do you do with the parents who come in and ask you the question of, does juice count as a serving of a fruit? Well,
technically, juice does count as a serving, but it can't be one of those. It can't be one of those juice cocktails that only has 15% juice in them. It's got to be 100% juice. So 100% orange juice, 100% cranberry juice. Not the juice cocktails, because those only have about 15% of the juice in them, and that doesn't qualify as a fruit a fruit serving.
And it really is just excessive calories with excessive sugar, so it's of really no nutritional value.
Absolutely. And unfortunately, all the calories that they take in from these sugar drinks will wind up all getting into the belly and into fat, and that leads to their problems. Another thing, too, that is also important is limiting the consumption of the sugar-sweetened beverages. This includes soda. This includes the fruit cocktails that sort of parade as fruit drinks but really are not. They have more sugar in them than anything else. I mean, a simple look at the ingredients label will really help them out. You have fruit sweet. You have the corn. You have the sugar-sweetened the corn syrup. The high fructose corn syrup, all this concentrated sugar to make it taste good. But the problem is that it's all extra sugar that can lead to the gut. So all of this, in my mind, I count as junk food.
Exactly.
Another thing, too, that's also important is to also bear in mind that there are other things, like, for example, even with milk, instead of whole milk, to switch to a low-fat milk, say 2% or even 1% or even skim milk if need be.
And what age would you suggest they do that?
That would be after 2 years old. Before that time, you need to have that fat for the development of nerves and for the development of their neurological function. Fat is important. It's an important part of the nerves. It's an important part. It's sort of like the insulation in a copper wire. You need to have that. It has to be developed. So whole milk is important for a child up to the age of 2. After that, depending on how the child is, if the child is beginning to have the show signs of obesity, then the child will have issues. I mean, the child should be brought down to, say, either 2% or even a 1% or 1% milk. If there's a child showing very flagrant signs of obesity, if they're above the 95th percentile, then maybe even skim milk might be a good idea.
Oh, that's great. So let's take a very short break with Dr. Martakis, and we'll be back soon. Welcome back. I'm here with my guest, Dr. Emmanuel Martakis, and we've just been discussing childhood obesity. Specifically, the last thing we left off on, we're looking at some of the helpful hints that we give to parents in our office for families who are struggling with obesity.
Thank you. So getting on with diet, a few other things to cover. One thing is a lot of people, they are eating out. They take a lot of fast food. That was something that we hadn't discussed yet. Fast food, you always have to be careful with what you get from Burger King, from McDonald's. They have increased their repertoire now to include salads, to include healthier foods, but you still have to be careful because even then, a lot of the food they cook in is still animal fats, a lot of lard. So my recommendation would be to limit the amount of fast food you take in on a regular basis.
Or even just to look at the menu, because when you're at either McDonald's or Burger King, they now have the calories listed next to it. So really look at what you're putting into yourself as well as your child's mouth.
Absolutely. And if you have the time, even being able to cook in is also important because with that you'll be able to know what you're exactly cooking with, what you're putting into your children's mouths, and that will be also a lot more wholesome and a lot healthier in the long run. A couple of other things that it's also important to look at for diet. These are things that have been more focusing on adults with their diet, but even now for children, we're also recommending diet rich in calcium. This includes things like cheeses, milk, yogurt, sardines, although not many people are really crazy about sardines.
Yeah, not a fan.
Other things, those two, that are easier for children to take, though. Fortified cereals, Post and Wheaties, and a lot of those cereals are rich with a lot of the vitamins, including calcium, enriched grains and enriched breads, and also, dare I say, leafy green vegetables.
So it really comes down to actually looking at the package when you're in the grocery store trying to pick out what to buy. You should read the label. Exactly.
I mean, it's important to be able to. Really, the most important faculty that we have is our ability to make good choices. But to do so, you have to be informed. They're already federally mandated to put down what exactly is in the food that they give us. So it's just up to us to take the time to actually look at the sidebar and to see what's exactly in the foods. What's the ingredients made of? How many calories is it per serving? And also to look at what exactly constitutes a serving.
Exactly.
It's news to some people that say 3 or 4 crackers is a serving rather than 20 or 30 crackers. But that's also something important to tell people and to educate them about. Another thing that I would like to go into, though, is also about activity, because that's the second pillar on a good regimen to help prevent obesity. So, and it's unfortunate that a lot of children don't really exert themselves the way they should on a physical.
What do you mean by that?
Well, the problem is that most children now, I mean, and most adults for that matter, don't really exercise with the kind of strenuous activity that we used to say about 40 or 50 years ago. So for the most part, even to get like an hour of physical activity a day, I mean, that could now be just walking or running or even just running around and playing outside. A lot of children don't even do that anymore. For them, like a physical activity is playing video games and playing on the computer, which may exercise their hands, but it doesn't really exercise the rest of their bodies, which is very important.
Now, for that hour, does it have to be continuous, or is it something where you could break it up a few times a day?
Yes, you can break it up a few times during the day, too.
Because I know with my 3-year-old, to hold his attention span for an hour, it's not going to happen.
No, definitely not. And even for my own daughter, too, it would be impossible to be able to keep her at one thing for 1 hour. But it doesn't need to be consecutive. But at least to be able to log in a total of about an hour a day of some kind of physical activity, that's important.
Now, how do you feel that TV or any of the media, the electronics, any of that, how do you see that fitting into a child's life?
Well, for a child below the age of 2, there shouldn't be any television. There shouldn't be any sedentary watching of any television at below the age of 2. However, above the age of 2, I would say to limit your screen time to about 2 hours a day. That's important. At least they find if they need to be engaged with television, that's fine, but not for too long, because then you start to have problems.
No, not to interrupt, but does screen time just include television?
No, it also includes computers, it includes video games. I think in the future it might also even include some of the more portable devices that we use, the iPads, the iPhones that I see children playing with now. I mean, I see them even using the iPhones even more well and more adeptly than their parents.
Oh, we are definitely guilty of that.
My own daughter can even access use the logon password already. It's scary, and she's only 18 months old.
It is definitely a scary world out there with the amount of electronics and devices that we have, especially with how the kids have the easy access to them.
There is one thing, though, that has been a very good thing, which does merit more investigation with regard to research. But when the children that use the Wii system, there is something called the Wii Fit that has been more and more popular as of late. I haven't seen any real studies yet on how effective it is, but it is definitely a promising show, especially if you're in the middle of winter and it's a snowstorm. It's kind of hard to tell the kids to go out and play when it's 30 below.
No, so it's always good to have backup activities, whether it's the Wii Fit or something else, where they can get some form of exercise inside the house.
Precisely. The other important thing to also bear in mind here is that even with the kind of like going back to diet, for example, even with the kinds of fats that people intake into their system, it's important also with regard to what people cook, that they should cook with oils that are lower in the saturated fats. This includes things like olive oil, canola oil, sunflower oil, vegetable oil, things like animal fats, coconut oil. Those are very high in the saturated fats, and that's something that has to be limited, because that's also important to also bear in mind. It's also with regard, when we said before about cooking being very natural, it's just as natural as what you put onto the pan or what you fry with.
No, absolutely. So now going back to some of the health risks that we had brought up, specifically looking at diabetes, I mean, now that we've heard ways to try to prevent some of that,
yes.
Have you found diabetes to be curable in children?
Well, the issue is defining what curable means. To cure it with regard to getting rid of it forever, no. Unfortunately, diabetes is not curable in that regard. It's controllable. It's controllable through various things. For type 2 diabetes, there is medication that children take. The amount of medication they can take may be weaned off to a degree, but really it involves also children managing and maintaining a proper amount of sugar in their diet. Because children that drink lots of sodas, children that eat lots of junk food, or also eat lots of cholesterol-rich foods, they're the ones that are less controllable diabetes. Children who eat more healthy, they stick with the balanced diet of the fruits and vegetables, a proportionate amount of grains, a small amount of fat, lean meat, not the fatty meats, but the lean meats, and also a small, very, very small amount of the milk or the butter. they can help to control their diabetes. But to just say that it's curable, unfortunately, that's not the case. We don't have the cure for diabetes yet.
Yeah, but it really all does come down to diet and exercise to try to control it.
Absolutely, absolutely. It's really going to be important to try to push this into them, especially since for children and teenagers especially, they have this whole aura of invincibility about them. And they also want to and they want to fit in with their friends too. So they want to go out and have that pizza with their friends. They want to go out and have the and share that huge batch of buffalo wings dripped in all the sauce and with the blue cheese dressing. They want to do that with their friends because they're going to feel like they're being left out. I mean, fortunately, now we're in a much better state than when we were, say, 10 or 20 years ago, where it was almost like you felt like you were out of place if you were eating junk food with the rest of the kids. But now it's becoming more and more in the mainstream to be eating more healthy, to have the salad instead of the hamburger, or to have the fries that are cooked with olive oil versus those that are cooked with animal fats.
Yeah, that's very true.
Mm-hmm.
So what would you say is more important for obesity prevention? Is it the actual quantity or the choice of food?
Depends really on who you're talking to, because unfortunately for some people, quantity is a big important matter.
Right.
With regard to sizes, we were talking before, I mean, you see how much some kids will eat. I mean, I remember with this one kid who could eat almost an entire chicken and consider it like an entire oven roaster and consider that one serving.
Wow.
So you also have to remember to talk. We also have to talk about to them how much they're eating versus what they're eating. For other children, it literally is a choice, because unfortunately I'll ask them, do you eat any junk food? And the child says no, and meanwhile I get this look from the parents saying, yeah.
They're sitting there silent but shaking their head yes. Oh yes, that happens all the time.
So you see a lot of this, and really it's important for doctors to talk about this, but it's also important for parents to get an idea, maybe even take an inventory of the pantry and to see what's in there that they might find.
House.
Exactly.
Absolutely, and not buy the stuff to put it in the house.
Exactly. That's the other important thing, too, because if mom and dad is eating it, then guess what? The children will find a way to eat it, too.
Oh, yeah.
And then, unfortunately for parents, and this is the big important point to ram home, is that if you're eating junk food, you can't really preach to your children about eating healthy food, because practice what you preach has always been an important guideline.
So really the big kicker for childhood obesity is to get the entire family involved and on board in order to really make the diet and exercise work.
Absolutely. And if anything, it helps out the parents too, because then they help with their own fitness. By having increased cholesterol is a bigger and bigger problem these days. And even for the parents too. And with parents, a lot of them are working. They're not there. You can't go to see the doctor. Sometimes even once a year is a luxury that they can't afford. So they wind up going into habits that may not be able to get any advice on, because they're not seeing their doctor.
Very true. Very true. So for our families who are at risk for obesity, do you recommend them seeing a nutritionist?
Yes, I do. The nutritionist helps to put things into perspective, because a nutritionist is especially trained on not necessarily what they should eat, but how much and in how many servings, how many times a day. They also will help them. They can help them to set up a food diary on what they eat on a daily basis. They can also help them to keep their food intake more regular. And it's also important, I think, to give them that kind of emotional support too, to let them know that what they're doing is right, even though they may not enjoy it. They may that they're at least working on their way to better health.
Yeah, and it's really important for the whole family to attend nutritional meetings, just so that everybody can be on the same page at the same time.
Absolutely, it almost turns into almost like a family therapy session when you think about that. It's a lot. It's a lot. It's a big task to undertake, but it's also a very important one.
No, absolutely. Well, we will be right back with Dr. Martakis after this short break. Welcome back. I just want to say thank you to our guest, Dr. Emmanuel Martakis, for being with us today to discuss childhood obesity. Thank you.
Thanks so much, and great being here today, Sarah.
For those families who are currently struggling with this, please feel free to come see us. We're located at the Port Jervis Center for Pediatrics at 140 Hammond Street, where walk-ins are always welcome. I just want to say thank you to everyone for tuning in. I hope you have an active and healthy week ahead. I'm Dr. Sara Little, and we'll see you again next week.
If you have questions for Dr. Sara, you can email her at drsara@middletownchc.org. That's Dr. Sara, S-A-R-A, at middletownchc.org.